Typhoid transmission and symptoms.
I'm Carolina.
I'm Eden.
I'm Joshua.
I'm Chantel.
I'm Emily.
I'm Abigail.
I'm Oriana.
So this is typhoid and transmissions and symptoms. So typhoid is a bacterial infection that affects various populations in northern Nigeria, and because transmission rates are so high, this means that infected people can spread this disease through various ways, whether it be in water, contaminate food, or just spread it to other people. The intent of our session is to promote community awareness of typhoid, its transmissions, and symptoms through our engaging activities and exercises that we created. With our target audience being children from ages 5 through 12, we want to ensure that these children end our session knowledgeable about all the effects, transmissions, and symptoms of typhoid fever.
Okay, so typhoid is caused by the salmonella typhi bacteria. Typhoid can be spread by flies landing on feces or urine and landing on the food that we eat. It's most commonly transmitted through contaminated water and food, which is linked to not washing your hands or washing your food. Okay, so typhoid symptoms can start appearing 1 to 3 weeks after diagnosis, and some common symptoms are prolonged fever, headache, diarrhea, constipation, and rashes. Some severe symptoms include delirium, intestinal hemorrhage, and confusion. Without treatment, neuropsychiatric complications can occur, and not being able to react to medication.
Next is high-risk areas. As you can see, for a small amount of people, there's a large number of cases. This is because typhoid is transmitted easily through big groups of people. When there's a lot of people living in a small area, it can be easily transmitted from person to person. And in developing countries, it is a lot harder for those people to recover from the disease. This is because a lot of them depend on each other to support their families, because most of them work very hard for their money and they cannot spend time away from their job. When they spend time away from their job, they're unable to support their families and unable to keep up their living standards. Children are more susceptible to typhoid from a younger age. This is why we targeted the age group 5 to 12 to be able to make awareness to these younger kids the help that they need. Next is impact on health and society. Individual sickness can affect their lifetime health because it can take them out of their work for a longer period of time. This will make them struggle more in the long run because they'll have to make up for the time that they're absent from their work.
Okay, our workshop deals with typhoid and its transmission and symptoms. The activities we established represented the findings of the state of typhoid in Nigeria, and we developed many objectives to help implement our activities in the Bauchi community. We are hoping that our exercises enable our target audience of children ages 5 to 12 to be able to be aware and spread awareness of the devastating effects of typhoid fever. The target audience, as previously mentioned for our workshops, is children aged 5 through 12. And this was because children's autoimmune systems are not fully developed yet, as well as children often have a harder time understanding the importance of hand washing and personal hygiene in general. We want children to understand in order to prevent further spread of this life-threatening disease.
So the first exercise we came up with was something called Typhoid Tag. It is a variation of a common game played in childhood called tag or freeze tag, if anyone has played that before. So this exercise takes around 15 minutes and we require at least 4 children. Obviously, the more children there are, the more fun it is. With your group of children, you're going to designate one child to be typhoid. Another child will be designated to be the antibiotics. Everyone else can just be a regular child. At the start of the game, we're going to tell children that they're supposed to run around. However, the child who is supposed to be typhoid has to try to tag other people. If you get tagged by typhoid, you're basically infected.
So, for example, if the typhoid person touches you, you have to stand still because you're infected and you're sick. The only way you're able to get back into the game is if whoever is the antibiotics comes and taps you again. This demonstrates to children that first, typhoid spreads really easily, and that second, antibiotics are the correct way to secure treatment to get over typhoid.
Exercise 2, 4 corners typhoid. It's played in a room with 4 corners. It can be played with 2 people, but it's easier to play with more. One person stands in the middle of the room, and the rest of the people go to a corner. The person in the middle counts to 10 and picks between numbers 1 and 4. Whichever number it picks, that corner is now contaminated with typhoid. If the player standing in the corner, the little person faced left, have contact with typhoid and are out of the game. The other corners have activities that explain ways on how not to contact typhoid.
So the third exercise that we came up with is called contaminated coloring, where it's a coloring book that shows the contamination of typhoid and the prevention. So, for instance, some of the pages show hand washing and the correct way to wash your food, because since those are the main ways that typhoid is contracted. And so we targeted mainly, once again, 5 to 12-year-olds.
Okay, so for our itemized budget, we ran the numbers and we're going to have crayons, markers, and paper for the activities that we have. So our markers, we have 12 packs and there's 24 in each of them, and the total would be roughly $47. The next thing we have is 10 packs of 24 count Crayola markers, which in total would be around $79. Our last thing was a pack of paper, which included 500 of them, and it would be around $7. So in total, that would be $135. So we did have like extra money left over. So what we decided to do with it is donate it to Save the Charity, which is a charity in Africa. Or Save the Children, sorry, which is a charity in Africa.
So for our handouts, we decided to do a simplistic poster showing the signs and symptoms of typhoid. And it should be easy to understand for younger children, as well as they may show their parents, so their parents may have awareness as well. We did also include digestive problems, so we made sure to make clear what digestive problems may be, such as diarrhea, vomiting, or constipation, as well as our coloring book previously described by Emily, which demonstrates washing food, washing your hands, and it's also key to remember to also boil your water before drinking it. This is our resource page. Thank you.
Thank you.